Hello, everybody, and welcome to another episode of Mind Matters, Navigating Head Injuries and Concussions. I'm your host, Kylie Como. I'm the legal nurse consultant here at Shane Smith Law, and today I'm speaking with Dr. Joshua Wheeler. Dr. Wheeler is a chiropractor at Lookout Valley Chiropractic in Chattanooga, Tennessee, where he specializes in helping patients recover from auto accidents, falls, and other injuries leading to head, neck, or spinal concerns. With years of experience in both traditional and advanced chiropractic therapies, Dr. Wheeler is passionate about individualized care, supporting clients who have suffered concussions and brain injuries, as well as those navigating the physical challenges of recovery. Today, Dr. Wheeler will share his expertise about the role of chiropractic care in brain and bodily injury recovery, helping us better understand how targeted adjustments and therapies can make a difference after trauma. I think given the wealth of information that Dr. Wheeler brings to the discussion, we're going to make this a two-part episode. And so with that, today's episode will touch on a chiropractor's role in treating concussions and traumatic brain injuries. So Dr. Wheeler, it's great to have you on the show today.
Thanks, man. Thanks for the awesome intro there too. I feel like you'd be a good hype man. That made me sound great. So I appreciate it, man.
That's my job.
I'm excited. You guys have a really awesome program, really awesome podcast covering some topics that just need more info and need more explanation for a lot of people.
Yes, 100% agree. And so happy to have you on. As our audience who's familiar with our show know, we have quite a plethora and diverse bunch of providers, TBI, brain injury survivors, to tell their stories and give their perspective. So we are glad you're here. Let's jump in. Talk to us about the difference between a TBI and a concussion. And, are they always the same thing?
Not always. So, one is an umbrella term being TBI. That's a traumatic brain injury. That's anything that's going to happen to the head. And that could be something tiny, a very minor injury, all the way up to something piercing through the skull, giant skull fractures, very serious issues. So TBI encompasses all head injuries. Concussion is just one of the TBIs, but it's probably the most common and most relevant with a lot of our patients and a lot of our cases. Because when it comes down to head injuries, you hit your head hard enough, you're probably gonna have concussion. And a lot of times our patients come in post car accident, post sports injuries, and they're more concerned about the neck pain or the back pain. They're not even thinking about the concussion. And so, TBI covers everything. Concussion is just one part of that.
Yeah, I think you touch on an important point, and I don't think it can be talked about enough that with our chiropractors, it's not just about that neck and that back, that traumatic brain injury in the head. I mean, it's all connected. And so the services, which I think we're going to dig into today, how you and other chiropractors actually treat those traumatic brain injuries. I think so many times people don't think about chiropractors and brain injuries, but you guys do a lot of work toward that, as you've alluded to. So if I'm somebody who comes into your office, I've had a head injury, what are kind of the first signs you're going to look at that might point toward a concussion?
Yeah, well, one important part is after an injury, you may go to the ER first, and you may present some symptoms. They may not be severe yet, but concussion injuries, TBI injuries can gradually get worse over a few days after an injury. So I think that's where chiropractic is so important is often that's the second step, and they're coming in a few days after the injury. So when they come in, I'm looking for the textbook signs, dizziness, are they experiencing vertigo? Headaches, is that still occurring? Memory issues. But even as that stuff clears up, we're still going to get a little bit more detailed and check balance, eye movement. Those things can still present signs of a brain injury without the patient really having those severe symptoms. It's very possible that gradual increase of the brain injury can present very subtly at first and sometimes get worse. And you want to make sure you check that box before you send the patient on to the next phase of care.
Absolutely. We spoke recently with a speech language pathologist, right? It was an interesting conversation, but it makes me think here again, as I'm talking to you, when people think of traumatic brain injury, concussion, et cetera, most people automatically think medical provider, neurologist, especially a concussion specialist. Those are the ones that diagnose and treat concussions, but it really takes that interdisciplinary approach to really properly approach that comprehensive treatment. So why should chiropractors be part of that conversation?
I think it's as a portal of entry should be the primary place to discuss, because if there is something more serious, if there's any red flags, anything I'm worried about, I'm going to send them to the right place. And that's what the chiropractor's role should be. Much like the ER doc, you go in, if there's something more serious, they're going to send you to that neurologist, send you for that CT. That's my role too. If somebody comes in here and they're presenting anything that I'm even a little bit worried about, a little bit concerned about after an accident, any kind of head injury, I'm going to send them to the right place. So I don't think it's an either or. I think it's, we work together, and if I see some of those red flags, I'm going to get them to the right person for further evaluation.
I think that's very important. Long gone are the days of the solo practitioner, right? That siloed treatment approach. So I think to be an effective practitioner, you've got to be able to recognize those things. So it's always good to hear providers like yourselves call that out and highlight that. I think that's more the norm than the exception anymore these days. But let's talk a little bit more about that collaboration. How do chiropractors collaborate with other healthcare providers, especially in this day where everything is so separated, if you will? You go to this provider for this aspect of treatment and this provider for that aspect of treatment, or maybe PT, et cetera. How do you manage collaboration when you're managing such a complicated injury like a concussion?
We definitely have our teams, right, and our referral networks, and I think that's an important part of it if you're going to have a solo practice, and that's becoming the norm because frustrations with just the system, insurance, hospital systems, all that right now. I think a lot of MDs, chiropractors, PTs are going into that solo practice role, but you do need to be aware that you need to form those referral networks and find a neurologist, find a imaging center in your town, find an orthopedic doctor, so you can cover all steps if that person's going to need that. But I think it's that just making sure you have those relationships in place so you can send them to the right place pretty quickly. But that's the blessing and the curse of being a solo practitioner is you can do a lot, but there are certain things you need help with, and you need to send out some.
Yeah, absolutely. You talk about concussion, and I think first and foremost, it's on the patient, right, to understand that there's an issue. So they have to be the one to take that first step and seek help. So the earlier the better is always going to be the case with concussions. I think specifically concussions. Time is brain, as they say in the ER, especially when you're talking about strokes and this and that. But concussions, it's not much different. That time is so important. Why is it so important to catch those concussions early, to diagnose them, and then get them treating? And then what are the risks if it's overlooked or maybe it's delayed?
Yeah, I think the biggest one is return to activity too quickly, especially in athletes, because that's the last thing. Unless you tell them not to play, they're going to try and get back out there on the field. And so we have a lot of patients that maybe they don't want to rush over to the ER. They were at the football field and we're open. They're going to come in here first. It's quick. It's easy. They're already established in the system. And so I need to be screening diligently, because if we miss it and we miss that concussion and they're back out on the field the next Friday, they could have a second injury, a second brain injury. And that's when we get into some pretty severe issues. If you have back-to-back concussions, your brain's already drained. Energy production is completely wiped after one concussion. If you have a second one pretty quickly, that can lead to some very serious side effects, even death in certain cases. So I think that's the main thing, is just making sure we prevent that person from going back to activity too quickly. Mm-hmm. And then giving them the right protocols to heal and to recover, and speed that up. Because even if the extreme symptoms are gone, that vomiting, nausea, dizziness, as those calm down, it doesn't mean you're 100%. And so if we can get them the right supplements, treatments, and just recovery protocols, it can make a concussion that could have lasted months, and the symptoms that could have lasted months last a couple of days. And then just screening for the more severe things, right? Those brain bleeds that can happen with severe head trauma. Often they don't present as severely as you might think. And that's another one, especially with severe head trauma, is that if you miss that, and if you don't catch that brain bleed or send them out for that right imaging, right treatment pretty quick, that you don't have a big window with those type injuries.
Mm-hmm. Yeah, most certainly. Yeah, those severe, serious ones, they can come on like an avalanche for sure, and not much time to respond. I think they are the most serious, but sometimes just as insidious maybe would be those ones you kind of alluded to, those longer lasting, maybe a little quieter symptoms. What might some of those be? You've gone through the acute phase, you're through the nausea, the vomiting, all that. What are some of those things for our audience benefit, those sub-symptoms, if you will, that might be in the background that people tend to overlook?
A lot of people think concussion and they think, okay, maybe 2 weeks, you're good to go, you're back to normal. But there's certain versions of a concussion and certain versions of head trauma that last months, even years. I mean, there are some people, and I'm sure you've had people on the podcast and interviewed people that they're never quite right. Big and important thing to factor in is documenting that, because if this is something that occurred at work, if this was an accident, you need to make sure that you're covered. And if you're going to have a 2-year injury, you want to make sure that's in place and that's documented from the get-go. If you do need to look at things like supplementation for your income or disability claims, things like that, it's a super important aspect of it. It's not only to treat it, but to document the injury as well that it occurred.
100%. On our side of things, on the personal injury side, that is something we are fastidious about, that documentation and making sure, providers and the clients, the patients themselves are documenting anything and everything, because it can make or break your treatment and your case. So I'm so glad you did call that out. Let's dig a little deeper into, chiropractic medicine, if you will. And, you talked about some of the benefits. What are some other benefits for someone with a concussion or a traumatic brain injury of sorts? What are some of the benefits that they might see from visiting chiropractor after, say, a motor vehicle accident?
One of the big things post accident is that if you got a concussion, you got a brain injury, you're restricted on blood flow. A couple of reasons for that after a head trauma, but the blood's not getting to the brain like it used to. You're not getting the glucose, which you need for that energy production. So one of the biggest things we can help with is calming down some of that muscle spasm in the neck, trying to release some of that tension, and then ultimately open up some of that blood flow so that we can speed up a little bit more of that glucose delivery and oxygen delivery to the brain. And then two, handling just some of if you're hit your head that hard, if you're in a position where you had a concussion, you probably got some neck issues, lower back issues going on too. From that happened to the brain, probably happened to the neck and the low back too. So addressing that aspect and just making sure that we're covering all the injuries at the same time. And then looking at supplements and certain things you can look at with your diet and lifestyle right after the concussion to heal, and kind of the quicker we point somebody onto those important lifestyle factors, the quicker they're going to heal too. So yeah, kind of all encompassing there.
Yeah, most certainly. And I think for our next episode, I would definitely like to dig more into some of those more, I won't say alternative or natural kind of approaches to treating that today's chiropractors are often using with great success. So let's backburner that one because that could be deep waters there. So you did mention, right? You mentioned the neck, the spine, whiplash, all that. You have a TBI. It doesn't always necessarily have to involve a direct head impact, correct? You can have a non-impact head injury, correct?
Right. I think that's one too that people think a common misconception with concussion is like, okay, I didn't hit my head, so I'm good. I don't have a concussion. There's no way. But it's really got to do with the acceleration and deceleration of your head or your entire body. So it could be you falling on your back or slipping. Any of those, if your head moves at a rapid enough pace and then comes to a stop, that can cause a concussion. The brain can actually collide with the inside of the skull or just be torsioned in such a way that concussion occurs. And so that's a pretty common one that patients just don't understand. Like, I didn't even hit my head. I don't have a concussion. I'm like, well, it doesn't have to. That's not always the case.
Yeah, that is a big one. We hear about that a lot ourselves. The brain it's in there literally floating in a sack of spinal fluid, if you will. And yeah, if you have that sudden deceleration, it's in there ping ponging off the inside of the brain or the inside of the skull, right? And that skull is not a perfectly smooth surface. Is that correct?
That too, even if it's not a big enough impact to actually hit the wall of the skull, even just the twist, from one half to the other half of the brain, that can be enough to stretch those fibers and cause that concussion as well. It happens more frequently than people think.
Yeah, I think you're right. I think people tend to gloss over some of those things, those rotational injuries. Let's talk about the neck a little more, the spine. How do you consider that part of, the traumatic brain injury when you have somebody coming in with those concussion TBI symptoms, maybe a little whiplash?
I got the model here just so we can visualize it, because you're looking at the blood flow through the neck. That's part of it. We touched on that a second ago, making sure we get the resources to the brain to heal, because post-concussion, all the energy is gone. It's all out of sorts in every metabolic and functional way. And so you want to get glucose so the brain can make ATP. So part of that is we address that portion of the spine, trying to make sure there's all that muscle tension post-whiplash is calmed down so that we're getting blood flow to the brain. But two, when you look at the top of the spinal cord that becomes the base of the brain, that's right at the base of the neck there too. And so if we're able to take some tension off that portion too, we're also affecting the nerve flow and as well as just the pressure and the inflammation that may be occurring right there at the brainstem, just trying to get a little motion and hydration back in that area. So both those are an important part. And then two, just the pain, getting somebody as functional as possible. If you're moving your head, you're moving blood flow. And so you want to open up that portal to the brain as well for recovery.
Yeah, and that makes me kind of I'm gonna throw a curveball at you. Do
Yeah.
you see much in the way of like TMJ, temporomandibular joint disorders, when you're talking about whiplash and concussion?
Yeah, it's that same overlap. All tension here, tension in the upper neck, at the occiput, at the C1, C2, pulling pressure back. That will amplify issues in the jaw. And then two, just the stress and coming to that kind of impact that quick can cause a lot of inflammatory response to the jaw too. So that's a side effect. And people are not thinking about any of this after a car accident. They're thinking about the big, my leg sore, or even extreme cases. I broke my leg. I broke a fractured finger. That's focus at first, and they're just all that other steps seem secondary.
Yeah, I'm glad you validated that. We can't imagine how many cases we've had that I've come across in treatment meetings where they've got this this TMJ that they're dealing with, but they always try to rationalize that as a separate issue. But it did happen after the accident. So
Yeah.
Definitely appreciate when our providers can kind of connect the dots there. It's an important piece.
Make sure, same deal. Make sure it's documented. Maybe this heals up in 2 weeks and everything's back to normal, but maybe not. And you don't want to be stuck paying for that yourself in those situations.
So what are some of the tools that you have at your disposal that you use to diagnose and confirm concussions or traumatic brain injuries?
So we do a lot of the textbook examinations. Biggest ones being like bombs for eye tracking, making sure that we're checking eye motion, that it's smooth. But what you're looking for in concussion is if the eyes are jumpy, if they're not moving smooth, they can't follow the finger. A lot of times that's one of those more subtle signs where they may feel mostly okay, but if the eyes are moving like that, that's not normal. Now we're checking balance, so we'll use best tests and make sure they're able to stand with their eyes closed. If they're twisting, if they can't seem to do that quite right, if they're losing balance, that's usually another pretty good indicator of concussion. And then we use something called impact testing, which is a pretty cool standardized test that they take on the computer. It measures them up against the baseline, and they ask them quite a few questions. It takes about 10-15 minutes, and then we've got that documented too. And a lot of times people think, oh, concussion has a perfect, this and this, you check this box, they've got a concussion, but there's not really a standardized, this is concussion if you have this or not. There's a lot of different options, and it's really documenting enough of those signs that you can verify that it is a concussion and get them on the protocol.
Absolutely. Yeah, you kind of alluded to one of my favorite words, right? Data. Data tells the story. And so all those tools that you're using, you're just gathering data, and it makes it it's not a subjective diagnosis at that point. You're talking about a real objective diagnosis because you've got hard data, to base your diagnosis on. Key, like you said, documentation, right?
Definitely. And you could have extreme symptoms but word of mouth isn't going to do it, especially when we're looking at those type cases where somebody's lives are really affected. If you don't have that covered, you can really hurt their case.
Yes, for sure. I know we're running up against time, but I know one question that our clients ask when they're onboarding a new case with us, they're talking about the treatment that they have done or are looking at. And, we're talking about things we've seen that have worked well. Chiropractic care, is that always an out of pocket expense for your patients after an accident?
Most of the time, no. And it really depends on, there's a couple different options for them. If they're not at fault and they're using car insurance, generally they're going to have coverage for these injuries. And chiropractic is not going to be a massive expense. Usually that's going to be covered straight from the car insurance. They can also use health insurance too. But a lot of times, if somebody was hit, they were in an accident, they come in, they don't pay a dime. We handle that, we treat them, we're focused on getting them better. We submit that at the end. We get paid later, but we're not as focused on that. Generally, they have nothing to do except present us with that information. And if they aren't billing under insurance, they also can use health insurance. And we're a network. Most chiropractors are a network with all the major insurance companies, and it's generally very reasonable.
That's great to know. And just again, to reaffirm for our audience, we do have a lot of folks that are recovering from brain injury or have somebody they love that is dealing with it. So making sure everybody has the resources they need, and that certainly, I think, opens some doors for some of our listeners to know that sort of thing. Very important. Thank you. So, Dr. Wheeler, is there anything else you'd like to talk to us about before we go out to the end of the show here?
No, just more awareness, right? I think that's the best thing you guys are doing is just to have that conversation. Even it's become a lot bigger topic in the last 10 years after, especially stuff with the NFL and NBA, where sports have really made it a lot more of a conversation. But yeah, just being more mindful of those head injuries. And then if you've got one or even think you might have one, go and get it checked. whether that's at your neurologist, at the chiropractor, go have somebody handle that.
Very true. Thank you for that. Great way to end the show. Well, that's going to do it for today's episode of Mind Matters, Navigating Head Injuries and Concussions. I want to extend our gratitude to Dr. Joshua Wheeler for joining us today and sharing his valuable insights on chiropractic care and brain injury recovery. If you'd like to learn more about or connect with Dr. Wheeler and his team, you can find them at Lookout Valley Chiropractic in Chattanooga, Tennessee, or online at lookoutvalleychiro.com. I hope our audience has enjoyed listening to this informative discussion and is coming away with a better understanding of how chiropractic therapies can support recovery after injury. Please don't forget to hit that like button and subscribe to our channel to keep up with our latest and our greatest content, and leave us a comment to let us know what you thought of our discussion today. And as always, remember, if you're in pain, call Shane at 980-999-9999. We'll see you next time.
In pain, so I call Shane. 980-999-9999. In pain, call Shane.